So, welcome back to the another video. So, we have discussed about 1 to 10 in the first part and 11 to 20 in the second part, and now we are discussing about the MCQ session of the hygiene chapter 21st to 30th question. Okay? Let us start, isn't it? Yes. First question, which nutrient deficiency is specifically highlighted as a contributing factor for development of pressure ulcer? So, what would be the answer? Option A, vitamin B12 and sodium. Option B, vitamin D and calcium. Option C, vitamin C and protein. Option D, vitamin K and iron. You written their names who are all standing there. Okay, let them sit. Sit down. Sit down, sit down. Now, with a peaceful mindset, okay, look at the question and look at the options. Which one you need to eliminate, you eliminate it, and which one is the correct answer, opt it. Okay. Just look at the smart board. Okay. No need of writing, nothing, it is there in the YouTube, you can see it. Okay. Yes, tell me. First, what is the first question in the 21st question? Which nutrient deficiency is specifically highlighted as a contributing factor for the development of pressure ulcer? So, to develop a pressure ulcer, which factor of deficiency is making contribution for the development of pressure ulcer? That was the question, right? And option A, these are the nutrients which are making the deficiency, sorry, these are the deficit nutrients or vitamins that will makes the contribution for pressure ulcer. Option E is vitamin B12 and sodium is deficiency is making the pressure ulcer. Is that the answer? Option B, vitamin D and calcium is making that deficiency, making that development of pressure ulcer. Option C, vitamin C and protein deficiency is making the contribution of pressure ulcer. Option D, vitamin K and iron deficiency is making the contribution for development of pressure ulcer. Which one is the answer? Option vitamin C and protein. So, we know that vitamin C, vitamin B12, isn't it? So, vitamin B12 and sodium is needed for the when it is needed. So, vitamin B12 is needed in the anemia, or else if there is a pernicious anemia, that time vitamin B12 is needed. Okay. Sodium, when there is a hyponatremia, if it is there, that time it is needed. Vitamin D and calcium, if the patient with osteoporosis, okay, that time these things are needed. Vitamin C, which is needed in wound healing, okay, and proteins are building blocks of the body, as I said, okay, that will develops the layers of the wound, right. So, there is a brick is protein and promotion of the wound healing by vitamin C, right. So, vitamin K is helping for the coagulation or else clotting, and iron is responsible for what? To prevent anemia, okay, to prevent the hemoglobin depletion, or else we can say decreasing hemoglobin will be prevented by presence of iron. So, more iron is also problem, iron toxicity, okay. So, which is the right answer then? So, which one will develops the or contributes for development of pressure ulcer? That is vitamin C and protein, right. So, vitamin C and protein is the right answer. And vitamin B12, so the deficiency if it is there, then there is a problem of a neurological deficit, and also if the sodium deficiency if it is there, that time there is a problem in what we can say some of the conditions like syndrome of inappropriate ADH and diabetic insipidus. In this you will, in these conditions you will see there is a variations in the sodium, right. So, coming to the vitamin C and protein, we have discussed that it will vitamin C is a critical for a collagen synthesis and immune function, right, and protein, that one you know, it is one of the brick or else building blocks to build the layers of the wound, right. Yes. Next question, during the procedure for pediculosis treatment, what is the rationale for applying Vaseline to the forehead and hairline? So, if you are applying the Vaseline on the forehead, what is the reason behind it? Okay. Yes. Option A, to help the loosen the knits from the hair shaft. So, whatever the eggs of the lices which is attached to the hair shaft, so that should get loose, for that you are applying Vaseline on the forehead. Is that the answer? Option B, to soothe the skin before applying a harsh disinfectant. So, you are applying some irritants solutions to the hair, okay. So, that in order to prevent that, in order to prevent the irritation, you are applying the Vaseline on the forehead. See, you are applying the Vaseline on the forehead and you are applying the irritants on the hair. Then, so is this answer? Option C, to prevent the lice from falling onto the patient's face. So, if you are applying the Vaseline, so that the lice will never fall onto the face. Is this the answer? Option D, to ensure the medicated shampoo does not run into the eyes. Okay. So, if you are applying the shampoo, that should not run from the hairline to the eyes. For that purpose, you are making the Vaseline on the forehead, applying the Vaseline on the forehead. Is this the answer? Which is the answer? C, to prevent the lice from falling onto the patient's face. See, this Vaseline will act as a barrier. So, before starting the procedure, we need to apply the Vaseline. So, after that we need to do the shampooing, or else we need to do the medicated shampooing according to the prescription, right. So, which one you will apply? That, as I said, kerosene and oil mixture you need to apply, right. Are you understanding? So, for the nits, you may kill the lices, or by how you are killing the lices? By applying the kerosene and oil mixture. But how we will kill the nits? Nits means eggs of the lices. That will never die with the help of this kerosene or oil mixture. Then how we will kill that? So, after 2 weeks you will observe again. Okay. So, after 2 weeks you need to observe if the still nits become already lice, or else if the nits is present, that time you need to apply 6% of acetic acid, right. Everyone understood this one? Yes. So, this is which is the answer then? Option C. So, Vaseline create a slippery barrier that prevents the parasites from migrating downward while the medicated treatment is applied. So, everyone understood this one? Yes. Next, third question, nurse identifies indigestion and loss of appetite in a patient, which a hygiene related cause might contribute to this systemic finding. Okay. So, is this lack of back massage, or is this infrequent bed bath? Option C, neglected oral care. Option D, improper nail trimming. So, nurse identifies indigestion and loss of appetite. So, they are not getting what? They are not getting hunger. The patient is not getting hunger also, and patients whatever the food is, now it has not digested. Okay. So, what is the reason for it? Which hygiene related reason that contributed in the systemic finding? What is the systemic finding? Loss of appetite and indigestion. This is the systemic finding you got. Finding means symptoms. Okay. So, patients is telling about the subjective data, and you taken that subjective data or chief complaints you can say. Now you want to identify the cause, what is the main cause for this, what would be the main cause, you tell me. Is that lack of back massage, you have not done the back massage, for that it is happening, or is that infrequent bed baths, sometimes you do the bed bath for the patient and sometimes you forget, for that purpose, or else is that neglected oral care will makes the indigestion and loss of appetite, or is that improper nail trimming will makes the patient to get indigestion. Which one is the answer? Yes, which one is the answer? Option A, B, C, D. Which one? C. Okay, we will see. Yes, good. Poor oral hygiene can lead to discomfort, infection and an unpleasant taste in the mouth. So, all of which decrease the desire to eat. Okay? Are you understanding? So, why it is not the lack of back massage is the reason, because it is providing the relief in the muscle tension, and also it may promote for sleeping also, okay, after the back massage, and it will promote the circulation correctly and it will increases the venous return. Okay. So, it does not have any direct connection to the GI tract. Okay. And coming to the infrequent bed bath, see, infrequent bed bath if you are doing means there is a problem in skin care. So, skin problem should get, not the systemic problem. Okay. Are you understanding? Next one is improper nail trimming. Okay, sir, if they have not done trimming correctly, then they may get indigestion, right. So, nail care is if they are having nail care problem, they can get feeded by someone else. Okay, if they are having paraonychium or else onycholysis, something this type of nail disorders, if it is there, they may ask help for the nurse, they may ask help for their what we can say attenders, their family members, they may ask, right. So, they may eat from them. So, there is no nothing, there is no connection to this particular nail trimming is not direct connection to the indigestion and loss of appetite. Clear? So, due to the poor oral hygiene, there is a discomfort feeling, and due to the improper eating practice will makes the person to get indigestion. If you are not chewing properly, 100% you will get indigestion. Clear? Okay. Yes. Next question, 24th. Which anatomical area is primary pressure point for a patient maintained in Fowler's position? So, if they are, I already said this one in the pressure ulcer class, isn't it? In the pressure ulcer class, we have said that which one is the most common pressure point or a bony prominences which causes the pressure ulcer. So, what is your answer? Option A, sacrum and ischial tuberosity for the Fowler's position, malleolus and greater trochanter for the Fowler's position, occipital bone and scapula is the most common site for the Fowler's position, patella and genitalia is the most common for Fowler's position. Which is your answer? Option? Which one? See, you concentrate the question correctly. What is the question? Which is the primary pressure point, or else we can say which is the most common pressure point for the to maintain Fowler's position first and foremost. So, not the pressure ulcer, leave the pressure ulcer, I am sorry. So, in order to make Fowler's position, you people are sitting, with what bone help you are sitting? This one I already said in the class also. Yes, which option is the right answer? Yes? It's not about the pressure ulcer, sorry, it's about the pressure point, right? Yeah, tell me then. Actually, both also will come the same answer. Where there is a more bony prominences pressure point, there will be the most common pressure ulcer, isn't it? If you are sitting more prolonged, then 100% you will get it, right? Yeah, tell me. I am asking you people. Which one is the answer? Option C. Option A. B and D is. See, malleolus and greater trochanter is for lateral position. Okay. Next, patella and genitalia. This is for prone position. Okay. Prone position. Occipital bone and scapula. This is for supine position. Option A, sacrum and ischial tuberosity is for the Fowler's position. Okay. 25th question. So 5 questions more after this. When providing denture care, see, every question is coming, right? When providing denture care, how should the nurse store the denture if they are not in patient's mouth? If you remove the denture, then in what solution or else in what thing that you will soak? Okay. Option A, wrap it in a dry gauze pad on the bedside table. So you with the help of dry gauze pad, okay, with the help of dry gauze pad, wrap it and keep it at bedside. Is that the answer? Option B, in a labeled container with a water or a normal saline, you keep and soak it in it. Is that the answer? Option C, in a cup of boiling water to ensure the sterilization, you in the boiling water you put that denture into it and you still make it boil. Is that the answer? Option D, in a container filled with a high alcohol mouthwash. So high alcohol mouthwash, so in that you need to keep your which one? Denture. Which one is the right answer? Which one? B. Let me see. Yes, good. That is the right answer. Next, getting into the 26th question. Is that interesting? Okay. It's a last period, I can understand. Some of them are going for sleep and dreaming about the question and answers. Huh? Concentrate here, right? Okay. A patient has a pressure ulcer. Okay. So from the last bench, we will take any one of the students so that you will be so much interested later on, right? Okay. Last one, any one of you stand up, or else within 5 seconds I will only tell. 1, 2, 3, 4, 5. Last bench, first one, stand up. Yeah, a patient has a pressure ulcer, okay, characterized by undermining and exposure of a muscle and bone. Muscle and bone is exposing. What stage is this? Very easy question. Unstageable, stage 3, stage 4, deep tissue pressure injury. Which one is the answer? Which one is the answer? Huh? You just say the option. Option A. You can't able to classify it. That's your answer. Okay, any others? Last bench Kannada hudugi. Yes. Option D, deep tissue pressure injury. Okay, next option C. Who will say option B? Option B. We will see. Option C is the right answer. How can that? See, if there is covered by eschar and, okay, when we can call as unstageable if it is covered by slough and eschar, and you have to remove that with the help of enzymatic action, then only we will call it as unstageable. Okay. What is the stage 3 means? Stage 3 means there is a exposure of subcutaneous only. There is no exposure of bone, there is no exposure of muscle, there is no exposure of tendons and ligaments. If that is tendons and ligaments, bones is exposing means that is 4th stage. Okay. Deep tissue injury, when we will say deep tissue injury, if you are hitting or if you are hit by any that hard surface and on the superiorly the skin is intact, but deeper tissues will get injury, that is called deep tissue injury. Are you understanding? Yes, it is not exposed. This in the deep tissue injury, it is not exposed. I hope everyone understood the 26th MCQ with the rationale. We will get into the 27th. Okay. According to the procedural guidelines, please be seated. Yes. Okay. According to the procedural guidelines, what is the ideal water temperature for foot soak? For foot soak, not hand soak. Hand and foot care we have done. So, in the hand, how much temperature should be there, and foot, how much temperature should be there, we have discussed already, right? Am I correct? Yes. In the middle bench, any one of you? Yeah, spect girl. Both of you are spect, right? First bench spect. Yeah. Yes. Tell me which one is the right answer. Option A 90 to 95 degree Fahrenheit. Option B, both of you, yeah, stand up. Stand up. Yes, 90 to 95 degree Fahrenheit, 110 to 115 degree Fahrenheit, 120 to 125 degree Fahrenheit, 100 to 110 degree Fahrenheit. Which one is your answer? Option D. So, for hand soak you need to use warm water, right? So, if it is more than 105 degree, you should not use it as a warm water. You just say a water with a temperature of 100 to 110 degree Fahrenheit. That is the correct answer. Okay. For the foot soak, we will do 100 to 110 degree Fahrenheit. Clear? So, very good. Please be seated. Next 28th question, last 2 questions remaining. After this, what is the primary rationale? Rationale means reason. What is the primary reason for using the lift sheets when repositioning a patient in bed? What is the reason? Option A, to prevent the shearing force by avoiding dragging the patient. Option B, to allow the nurse to move the patient without assistance. Option C, to provide extra warmth for the patient during the move. Option D, to keep the bed linens clean and dry. Which one? So, we will give a hint. Think about the type of physical force that occurs when skin is pulled across the fabric surface. Then which is the right answer? A. B. Why it is not B? Option A is the right answer. So, option B, to allow the nurse to move the patient without assistance. Actually, you people are lifting the at least draw sheet, right? Are you understanding? You are lifting the draw sheet. That means it is assistance only. Clear? Without assistance, it is wrong. You are doing assistance only by lifting the draw sheets, right? Okay, I hope everyone understood about this one. We will get into the next last second question. Which condition is characterized by a diffuse scaling of the scalp, often accompanied by itching? Itching is also there and diffuse scaling is also there. What type of hair condition or a scalp condition is this? Pediculosis, ticks, dandruff, hirsutism. Dandruff. Pediculosis means there is a presence of lice attached to the hair, as I said, and with their along with their nits. Ticks means it is a ticks which is attached to on the skin, where it will suck the blood, okay, until and unless if you are not putting the drop of petroleum product, okay, that will not get off from the skin. It will keep on sucking the blood from it, right? So, that one is a ticks. Hirsutism means it's a excessive growth of hair, especially in the females. So, androgenic problem. So, there is a development of the beard also, develop mustaches and body hairs. Okay, it will be increasing in the excessive hair growths. Clear? So, then the answer is option C, that is dandruff. You given the correct answer. Good. So, it is a dead skin cells. Okay, dandruff is dead skin cells. Last question about the Norton scale. In the Norton scale, a patient who is stuporous would receive how many points for mental condition? Okay. So, in the Norton scale, I think you know about the Norton scale we discussed. In that Norton scale we said PUMMY. You remember that PUMMY? Yes. In that M, mental condition will also come. So, wait for a minute, because I know questions are there that I need to give for you in the test. So, I do not want to expose that now only. So, carefully I need to do the classes for you also. Yes. So, where is the Norton scale, man? Where it is? We have done a number of topics here, no? Yes, Norton scale. So, here it is the Norton scale. Can you say what are the PUMMYs are now? I will make it on now. Yes, tell me. PUMMY means what? Yes, PUMMY means, can you able to say this? These are the categories, or else we can say the parameters of the Norton scale, where we can see PUMMY. PUMMY means PAMMI, PUMMY. In that, physical condition, mental condition, activity, mobility, incontinence. So, by seeing their score itself, you can say how much point it will get. Okay. So, stuporous is there, confused is there, apathy is there, okay, alert is there, oriented is there. So, totally we have 1 to 5 scoring. So, among that, what was the question is? The question is, what is the point will be? Now only I shown. Yeah, tell me the answer. After showing the PDF also, if you are not able to tell the answer, then you people are so much ultra legend in the world. Yes, 100%? Yes. So, stuporous is the one point you are going to give. So, I hope everyone understood about this today's class, okay, today's MCQ. I hope you people enjoyed. So, if you enjoyed, give the like and share to the many people of your same age and same class. Thank you for watching this video.